Good afternoon, and thank you for joining us today. As many of you know, a number of counties throughout the state have reported cases of monkeypox virus, or MPV. I'm here today to discuss a case in Champaign County and inform everyone that we are undertaking a robust effort to address the situation. An adult at a daycare center in the Rantoul area has tested positive for a case of monkeypox. Screening of children and other staff is taking place now, and no additional cases have been found at this time. All available state, local, and federal resources are being deployed to assist families. At the discretion of Governor Pritzker, the Illinois Department of Public Health is focusing on making sure that families have everything they need. Governor Pritzker and I have been in touch with the White House, and we are happy to report that President Biden's staff has been incredibly responsive. We are pleased that at our request, the FDA, the Food and Drug Administration, has authorized use of the vaccine for anyone under 18 without jumping through the normal hoops in this process. That means that anyone with their guardian's approval will be vaccinated today. Pediatricians are on site as we speak to screen children for cases, and there are mobile testing and vaccines for their families. Health officials will continue to stay in contact with families and provide information and resources in the coming days. The adult also works in a home health care, and we are in contact with the one client who has been impacted. Governor Pritzker's administration is also working to provide financial resources for impacted families so they can quarantine safely without fear of losing income or work. I also want to assure the public that this monkeypox virus is not an airborne virus. It is spread only through skin-to-skin, close or intimate contact. Here are a few examples on how it's spread. First, direct contact with an infectious rash, scabs or bodily fluids, respiratory droplets during prolonged face-to-face contact or during intimate physical contact, touching objects or fabrics that previously touched the rash or body fluids of someone with monkeypox, or finally being scratched or bitten by an infected animal. The good news here is that there's a vaccine for MPV, and we are working with the Center for Disease Control and Prevention and the federal government to secure vaccine for impacted individuals, and we've already begun administering doses throughout the state. At this time, it's my pleasure to bring forward Julie Pride, the administrator of the Champaign Department of Public Health, to provide an update for this area. But before we do that, Guadalupe will be kindly translating this information for everybody in Spanish.
Buenas tardes. Como ustedes ya saben, hay un número grande en el condado de Champaign de la enfermedad del mono, el virus del mono. Se anunció que hay un adulto en un daycare en el centro de Rantoul que ha sido positivo para el caso de la viruela del mono, monkeypox. En este momento se está llevando a cabo exámenes a los niños y a las personas que trabajan en ese lugar, y no ha habido otro caso de la viruela. Todos los estados, los recursos federales están llevando a cabo la investigación con todas estas familias, y la dirección del gobernador Pritzker de Illinois, el Departamento de Public Health, está enfocado en hacer de que las familias tengan todo lo que se necesita. También quiero informarles que esta enfermedad no se transmite por medio del aire, es una transmisión que se transmite a través de la intimidad, contacto directo con las personas o con la llaga o con el rash de la persona. Si usted está cerca de una persona que tiene esta viruela y está hablando con ella, si se prolonga por mucho rato, podría ser por la saliva. Y también por el fluido de la roncha cuando sale. Es la manera que se puede contagiar. Gracias.
Thank you, Guadalupe. Good afternoon. My name is Julie Pride, and I'm the administrator of Champaign-Urbana Public Health District. CUPHD was notified yesterday of an adult in our jurisdiction who tested positive for monkeypox virus. This is the third case we've had in Champaign County. As this person works for a child care facility, CUPHD reached out to Carle Health System to assist us with the screening and assessing everyone who may have been exposed. Carle pediatricians, physicians, and other staff are assisting CUPHD staff with this process. If we do uncover any additional cases, we will be following those as well. If your child has had the potential of being exposed in this outbreak, you will receive a call from Champaign-Urbana Public Health District. You do not need to call daycare centers. You do not need to call public health. You will be contacted. The person with monkeypox is in isolation, is being medically monitored, and is doing well. It's important that the public understand that the monkeypox virus is different than COVID-19. Monkeypox is not airborne. It is primarily spread through close skin-to-skin contact, but it can also be spread by droplets during prolonged close contact and through contact with items that may have been contaminated, such as towels or bedding. Monkeypox is not a sexually transmitted infection. It's a virus, and viruses do not discriminate on who they infect. This press conference is not meant to alarm the community, but rather to be transparent and to answer any questions that the community may have. Just like with COVID-19, we want to fight fear with facts. I would like to thank the Illinois Department of Public Health, the Centers for Disease Control, for working so closely with us on this situation over the past couple of days. And I would also very much like to thank Governor Pritzker's office and President Biden's staff for assisting us with this rapid response. Guadalupe will now read this. Thank you.
Mi nombre es Julie Price, soy la administradora del Centro de Salud de Champaign-Urbana. Ayer me avisaron que un adulto en nuestra zona se diagnosticó con la viruela del mono, monkeypox. Este es el tercer caso en el condado de Champaign. La persona que se ha contagiado está aislada y está siendo ya estudiada por los médicos y los doctores. Es importante que el público entienda que la viruela es totalmente diferente al COVID-19. La viruela no se contagia a través del aire. Primeramente se contagia por contacto directo de piel con piel o con algo que esté infectado que se junte a la piel. Posiblemente se puede contagiar también por medio de la saliva cuando habla, pero tendría que estar en un contacto prolongado con la persona para que se haga ese tipo de contagio. Cosas como toallas, sábanas, hay que tener cuidado, podría ser también si la persona que tiene el virus estuvo en contacto con esas cosas. Estamos trabajando muy cerca de todos los casos y no queremos que esto no es que se alarmen. Estamos trabajando con la persona que se contagió y con todos los que están y estuvieron a su alrededor. Muchas gracias.
Thank you, Guadalupe. I'm happy to take some questions from the media. Please.
What age group at the daycare center that employee?
To protect the privacy of this adult in the daycare center, we can't provide any additional information. We know that the Champaign County Public Health Department will be contacting all individuals and families that would be affected.
Is that daycare still open, or what cleaning assessments are going on now at that daycare?
So I'll pass it to Administrator Pride to kind of answer that question.
Sure. It is, and it has been cleaned. They were notified. It is. Then they were notified, immediately. The people who have been exposed potentially do not need to be in quarantine, so they are being screened and assessed. Anyone with even, a tiny little suspicion, we will put them in isolation pending any type of results. But they have the guidance for cleaning, and they have done that. Probably a lot more than is even necessary. And I also wanted to mention that we have Dr. Healy here and Dr. Chan from Carl also, if you have any questions as well.
Explain a little bit more about the vaccination component of this. Are you guys on site? Is Carl on site doing vaccination of anybody 18 and over that wants it?
No. What's happening is we are doing anyone who has been exposed, so that would be any of the children who potentially were exposed, any of the contacts, family, anyone who has potentially been exposed in this situation is being offered the vaccine. So, and yes, we're on site providing it. Public Health is there as well as Carl.
Do you have to be 18 to get the vaccine, or can it go to children?
It can. It can if they're exposed in the situation, it can, yes.
What's the minimum age for it? Is there one?
Yeah, okay, 6 months, Dr. Healy said. Yeah.
I know there was talk early on about certain people in the community not having access yet just because of limited supply, but can more people be eligible now because of what has happened?
No, we're still it's still going based on where the cases are. So, we encourage anyone that has any questions or that thinks that they may need to get vaccinated they can email monkeypox@c-uphd.org, and we'll have someone call you back and get you screened.